When patients are considering breast augmentation, there are numerous choices that you have, and one of the most important ones is where the incision goes. There are basically 3 different choices for that. They can go in through either around the nipple area, underneath the fold of the breast, or underneath the arm. Now, there are specific pros and cons of each of those, and universally it's kind of come down to a certain path, but we'll kind of work through all of that. My first consideration is that the incision underneath the arm, I don't favor. Some people may perform it well through that, but it takes tunneling through the tissue, through a number of different planes of tissue that shouldn't be violated and really are necessary to maintain the position and shape of the breast once the implant's in place. And when we're working through a long tunnel, we don't have as much control over the position or the shape of the pocket. Those are all important things. The incision around the nipple area, actually I used to favor because it is right at the texture change and the color change of the tissue, so the incision fades pretty well right there and is a little harder to see when it's all said and done. But recently there have been a number of studies out that have shown that if we place it through the nipple, we're pushing it the implant past all the breast tissue, and breast tissue naturally contains some bacteria. And as we push the implant past that, it can glom itself onto the implant, and then it just causes chronic, slow, smoldering inflammation that can develop capsule formation or extra scar tissue formation. And frankly, we don't want to set ourselves up for a problem if it can be avoided. The incision along the fold of the breast is the one that's most supported now, because we don't have to go through the breast tissue to get there, and we have ready access to the pocket underneath the muscle, and so it's just a little less likely to cause problems in the long run, and we want to go the safest method possible. One other incision that could be considered, or just you need to understand for why we don't like it, is the incision around the belly button. That is popular in some areas. There is a technique called the tuba procedure where an inflatable balloon is placed up into the breast blindly and used to expand the tissue to create room for the implant. The American Society of Plastic Surgeons doesn't endorse that, that procedure because of the poor predictability of the results with it. It's a blind procedure. You don't see exactly where that implant's going, and again, we don't want to set ourselves up for troubles. Good luck with your breast augmentation, and just keep this in mind as far as what information you utilize to make your decisions.